Okay, so hair loss after surgery is probably one of the most common things we hear about, but it's really, really hard to treat. Again, it's part and parcel of successful surgery. If you lose weight rapidly through any means, you're more likely to lose weight. Medically, it's called telogen effluvium. It's very common. It happens in up to half of patients that have weight loss surgery, particularly in females. And I do think females notice it more than males as well. It's a type of hair loss that happens when the hair follicle, so where the hair grows from, enters into the resting phase of the hair growth cycle called the telogen phase. And it goes into that resting phase prematurely, which means a lot of the hair follicles are going into the resting phase all at once. And so your hair might become more thin or start to shed. There's a few things that can contribute to hair loss after weight loss surgery. Number one is how quickly you lose weight. So rapid weight loss disrupts the hair growth cycle and leads to hair loss. Number two, nutrient deficiencies. So if you're not getting enough protein per day, that 60 to 80 grams that we keep going on and on about is really important. And also certain vitamins and minerals. So you need to make sure you're on your multivitamins every single day. And finally, hormonal changes. So weight loss surgery itself can alter hormones in your body which affect hair growth. So you might find as a result that your hair is thinner, or you start to shed your hair, or it's more brittle and it breaks more easily. So to prevent the hair loss after weight loss surgery is really hard. The only good news is if you're a slow loser in terms of the speed with which you lose weight, you're less likely to lose as much hair or find as much brittleness and breakage of your hair. Some things you can do. Number one, speak to your dietitian. Make sure you are getting enough protein, multivitamin, your nutrients that you require, blood tests that we normally do at 6 and 12 months. In addition, make sure you're getting enough water. Look at what shampoo you're using and try to avoid heat. Heat protectants don't work very well when you've already got thinned and brittle hair. If you're using any sort of hair treatment, particularly if you're using a hair straightener, then this will speed up hair damage. Next, there are some medications that can stimulate hair growth. Now, the one that's most popular would be Nioxin, which can be a topical treatment. This is sold in various forms in your local pharmacy. It can help stimulate hair growth, but it doesn't get your hair back to where you'd started prior to surgery. The good news is it doesn't last forever. The first 6 months are often the worst. 12 months on, your hair will start to stabilize into the natural hair growth patterns and it gets better from there. Do talk to either your GP or your healthcare provider about other means.